Good afternoon, everyone. Thank you for joining us for the Perceptions of Community Safety in Iowa, a presentation where we're going to cover survey results and have a panel discussion. This is a collaborative space with 4 organizations present. We have Iowa HHS. I'm Monica Gedkin. I'm the Violence Prevention Coordinator. And Iowa HHS provides high-quality programs and services that protect and improve the health and resiliency of individuals, families, and communities. Today, we also have Monsoon Asians and Pacific Islanders in Solidarity, whose mission is to end all forms of gender-based violence and build healthy communities through transformative justice and social change. And with us today, we have Mira Youssef, the Executive Director with Monsoon and the co-founder of Monsoon and National Asians and Pacific Islanders Ending Sexual Violence. Additionally, we have Iowa CASA, whose mission is to end sexual violence and improve support available to survivors of sexual assault. And with us today, we have Kelly Marie Meek. Kelly Marie is the Prevention and Public Health Initiatives Coordinator and the co-creator of the Safe Youth Collaborative site. Additionally, we have the University of Iowa's Injury Prevention Research Center, whose mission is to support multidisciplinary academic and community efforts to prevent and control traumatic injuries and violence, especially among our rural populations. They are 1 in 11 nationally, so we're very fortunate to have them here in our state. And representing our Injury Prevention Research Center, we have Carrie Harland, who is an assistant professor of emergency medicine and research core director for the Injury Prevention Research Center. We also have Abby Schuler, who is one of our program evaluation program directors. And then we have Abby Richardson, who is also one of our evaluation program project staff. You can advance to the next slide. Thank you. I'm very excited that we are coming from this space related to our rape prevention and education program. So high-level overview, the rape prevention education program is funded through the Center for Disease Control out of the Injury and Violence Prevention Division. So we have population-specific funds that each state is eligible to apply for to help with preventing the first-time occurrence of sexual violence. So we are looking to prevent sexual violence before it begins. In Iowa, we are especially focused on preventing sexual violence, both the problematic sexual behaviors that contribute to causing harm to others, but also the victimization of individuals ages 0 to 24, with a very special focus on our 9 to 17-year-olds. We do this by addressing the social and environmental factors that are correlated to higher prevalence rates of sexual violence. One example is going to be societal norms that support aggression towards others, or having not having nonviolent problem-solving skills. We do this successfully in Iowa by using multi-sector collaboratives, which you see represented here today. And some primary elements are that we plan, implement, and evaluate all of our programs, strategies, and activities. This is a very high-level overview of the history of the rape prevention education program here in Iowa. Starting in 1994, when federally, the Violence Against Women Act was authorized and designated funds for preventing the first-time occurrence of sexual violence. In the late 90s, Iowa CASA began receiving funds from Iowa HHS. At the time, it was Iowa Department of Public Health, and our certified sexual violence prevention specialists across the state delivered curriculum. Our partnership started with the Injury Prevention Research Center in 2008. And then you'll see a couple different activities happening. Again, this is very high-level overview. We also had some really big successes with the Cost of Sexual Violence in Iowa report coming out in 2009. And we built a lot of state level advisory groups and different programs across the state that have helped us get to where we are today. I'm going to pass it over to Carrie Harland, who's going to cover our survey results.
Thank you, Monica. So we're today speaking about a survey that was completed in 2021 to try to understand the beliefs, attitudes, and experiences of Iowans around the issues of violence and safety. So we all understand, right, in order to change behavior, we often first have to understand and change beliefs and attitudes. And throughout our state, there is surveys completed where we can get some information on violence experiences, but currently there are no surveys about beliefs, attitudes among our Iowans. And so we undertook this survey starting in 2019, and then this pandemic started, if you don't remember, and then there was an election. So we actually didn't complete it until 2021 to try to get people to answer their phones. So you can see here it was a survey of 18 to 65-year-old Iowans. And it was both cell phone and landline, as well as a push to web survey. And I see here that we have put in the list to the full report, as well as the methods for this this survey. And it was offered in both English and Spanish. So to try to understand these numbers down here, when we sent out letters to everyone to invite them, and about 1 in 3, so 33%, responded to that letter and said, yes, I'm interested in potentially participating in your survey. And among those who responded, over 80% said, sure, I'll do the survey, which left us at a sample of 621 participants. And here's just a very brief overview. The full demographics of those in the survey is available in the report. You'll see among everyone who completed the survey, about half were male, half were female, largely ages 35 and older, and most had completed at least some college, which is very similar to the demographics of those in Iowa. We tried to weight this report to ensure that that was true. Some of the survey results we're going to focus on are specifically about parents. So I wanted to provide that data here. And for the survey, parents were defined as, do you have a child in the home the child of a parent. Are you a parent of a child, 25 years or younger? And you'll see here among our respondents, the parents were more females than males, and also a little bit older, as you might expect, and had higher education levels. Next slide. Overall, we found in the survey, when asking about experiences of harm, that the majority of people knew someone who had experienced harm, with almost over 2/3 knowing someone who's experienced dating or intimate partner violence, so harm caused by an intimate partner. Half knew someone who experienced sexual violence, and almost half of those knew someone who'd experienced abuse and neglect. And the proportions those who personally experienced this are very similar to what we've seen nationally. So about 1 in 5 had experienced sexual violence, and about 1 in 4, and about 1 in 5 had experienced child abuse or neglect. So to really understand the attitudes and individuals' beliefs about these different forms of violence, we asked them, how big of a problem do you think these different forms of violence are here? So if you'll see at the bottom, there is a legend that shows not at all a problem, then a small problem, moderate problem, or a very big problem. So for each of these forms of abuse or neglect and violence, child abuse, neglect, intimate partner violence, we said, how big of a problem do you think this is? And you'll see overall, particularly if we're talking about sexual violence, elderly abuse, individuals didn't think that it was not a problem at all. But I'd like to highlight here what we see under youth violence and bullying, where actually that's the smallest proportion. So the majority of Iowans believe that, you know what, youth violence and bullying is a pretty big problem, with almost 20% saying it's a very big problem. Next slide. And so we're like, okay, well, if you think it's a problem, we're thinking about primary prevention. And so we want to understand, how much do you think that this can be prevented, right? A lot of the work we do in injury and violence prevention is around, changing that mindset that these forms of violence and injury can be prevented. And this slide, or this chart, is set up very similar, except for in this case, all the way at the left is little or none. So it cannot be prevented. Some of it can be prevented, most or almost all of it can be prevented. And here you see a large proportion, particularly among the abuse and neglect that individuals believe can be prevented. But again, under youth violence, we see about, majority of individuals believe that youth violence and bullying can be prevented. And so in thinking about how we change behaviors, one of the things we were trying to understand is among parents in Iowa, how are they communicating with those or guardians, parents or guardians, communicating with the youth in Iowa about either causing harm. So you'll see on the left, there is a graph about causing harm. So this means not hitting people, not being a bully. And then on the right, you'll see being harmed. So what we often think of as victimization. So, particularly when we're thinking about sexual assault, right? A lot of our prevention programming, unfortunately, is focused on not being harmed versus not causing harm. And you'll see here overall, 80% of parents said, yep, I talk with the children in my home about not causing harm and not being harmed. And you can see here that it really is focused on bullying and physical violence, with over 50, almost 50% saying, when I'm talking with my child about not causing harm, we're talking about bullying and not committing, not hitting, kicking, those sort of things. But when I'm talking about being harmed, it's very similar again. So as Monica had alluded to, right, we're very interested, the work that funded this was through the Rape Prevention and Education Program. And so we see here that like sexual assault and dating violence are conversations that aren't had very often by parents with their children. Okay, next slide. And so we wondered, okay, well, what parent demographics characteristics are associated with having these conversations. So you'll see, again, this is each of these columns represents they had a conversation with a child. And I forgot to say this, we asked them about their oldest child. So if they had more than one child in the home, we asked about their oldest child. So among parents who identified as males, 80%, said, yep, I talked with my child about being harmed and also about causing harm. And overall, it's a really high proportion across both gender and rurality of residents. So we looked at the county in which these individuals lived and to see if that had any association. And we found overall there was an association until we did a comparison of males and females within urban and rural. And this can get a little complicated. So if we're thinking about the female parent in an urban county, and urban in Iowa, we're thinking like maybe Iowa City, Des Moines, those sort of things. Compared to those female parents, male parents in urban areas and female parents in rural areas were actually more likely to talk with their child about being harmed. Unfortunately, there weren't any associations with conversations about causing harm, right? So if we're thinking about primary prevention, we really want to focus on, those conversations about not causing harm. Next slide. Really briefly, just a quick overview of some of the limitations, right? So in retrospect, this always happens. It seems like when you do a survey, we did, again, ask about the ages of the children and ask them to think about their oldest child, but we didn't ask about the sex or gender of that child, which I think we can hypothesize and think about why that might actually be a lot different, what types of conversations you're having depending on the sex and gender of your child. And then we did ask a few questions to try to figure out if those who are answering our survey are different than those who didn't. And about 1 in 5 or 1 in 4 had volunteered in some sort of violence prevention or crisis response system. But we didn't think that was much different than what we see across the state. And then lastly, we have this thing that we call social desirability. And it's this idea, I'm going to tell you what I think you want to hear instead of how I actually feel or how I've actually acted, right? So we could have parents that, over-reported that I talked with, a child about those sort of things. Next slide. So in conclusion, if you remember back to the very first results slide, intimate partner violence, dating violence, and sexual violence are actually quite common in Iowa, right? We have either experienced this harm ourselves or we know someone who's experienced this harm. yet it was viewed as not a big problem, right? When we're asking about, people's perceptions, and parents were less likely to talk with their children about these topics. Suicide was also viewed as a big problem, but also thought to be a very preventable problem, which is great when we're thinking about how to make changes in that area. And lastly, youth violence and bullying were viewed as like the biggest problem that we have in the state of Iowa, also the most likely to be prevented, and the thing that parents talk with their children most about. So if you think about developmentally, maybe some of that makes sense with bullying and talking with your youth. But overall, we're seeing some, good connections and disconnections in what we're seeing in the survey. Next slide. I think it's back to Monica.
Thank you so much for providing that overview, Carrie. For the panel discussion, everyone, we're going to start with a couple questions for the folks that we have on, and then I'm going to open it up to the audience. And so for the first question, there seems to be a disconnect in what the data is showing us and what we know. We see there is significant violence in our communities. For the panelists, can you tell us more about your impressions or how we can interpret these results?
Yeah, I can start with that. And just for the audience, again, I'm Abby Schuler and I'm with the Injury Prevention Research Center. I think one of the things, and we've touched on this a little bit, it's a little bit different with how we approached this topic. And again, Carrie had mentioned, we asked about people's like beliefs and perceptions of violence with this survey. And I think what people are used to seeing is like the reported data, which means like the incidents of violence. That would be like police reports, and in schools with bullying, that might be like bullying reports or suspensions and expulsions, things to that effect. Um, Beliefs and perceptions are a little bit harder to quantify. So that's a little bit different and it could be different from day to day based on what someone's, yesterday was like. So those two things are different, kind of hard to marry and make sense of. And I think it's also important to recognize that we saw also the comparison of people who knew someone who had experienced violence and how high that number was, and people who thought that violence was a problem. And while that number is still kind of like higher to me, I'm not like feeling really great about the number of people who are saying that they felt violence was a problem in this state. But the dissonance between, right, like I know someone who's experienced, but I still feel like my state is safe. And I think sometimes people personal experiences with violence that might be attributed to like something that I personally did or that person personally did. That was just their experience or something like a fluke. And it's not seen as a community problem or a state level problem. And so that could be a perception or reason that was kind of a reporting theme that we saw as well. And especially with youth violence, as that was a really big theme from our survey. One thing that has been seen over and over in literature when we're surveying parents and when we're surveying kids is that youth very rarely talk to the adult first. If they are going to report bullying, talking to the adult first is not typical. If they report it, they're going to tell a friend. And them seeing it as violence is also something that, whether it's a youth or a parent, seeing that as violence. So the kind of categorizing these kinds of things, it's very different than something like sexual assault that you might see in a police report. So all of those different things, that's why it's important to have these kinds of conversations and talk to people about what their actual lived experience with safety and violence is and how they perceive it in real life.
Thank you, Abby. Mira or Kelly Marie, did you have anything else to add before the next question?
Sure, I can add a little. So again, Kelly Marie from Iowa. I think, Abby, a lot of the things that you were saying were resonating with me. One of my baseline places that I always start is that we know that when we're talking about sexual violence, particularly, that's one of the most underreported crimes that we, right? And so I always am starting from that place. And when I think about that disconnect between people who are reporting that they've had an experience or know someone who's had an experience versus people who think about what kind of a problem that is, I think that that underreporting certainly plays a part. And we're not just talking about reporting to carceral systems, police departments, and things like that, or DHS. We're also talking about reporting even just to an adult if it's a youth who's experiencing it. I have 5 kids, but my 11-year-old specifically comes to mind. We're very close. We talk about a lot of these topics. And just last week, there was a fight at his after-school program that I got an email about. And when I talked to him about it, he was like, oh, yeah, that's a thing that happened. But in all of our talking about the day and what was going on, like it did not even rise to his level of something that he wanted to talk to me about. Right. And so there's just a lot of disconnect when we're thinking about that. The other thing that I think helps explain some of that disconnect is that, and this is something we talk about a lot kind of as a movement, is that our definitions of community are not all the same. And so when we think about what's happening in my community, what does that really mean? Are you talking about in my geographic neighborhood? Are you talking about in my school, in my workplace? Are you talking about in, other communities that I might identify with that are not geographic, right? But are more, cultural communities. And so that I think makes it a little bit difficult sometimes for people to be able to answer some of the questions that we really want to know. Because there is very much a sense when we're talking not just about sexual violence, but all kinds of violence, that there's a problem, maybe it's over here. And again, whether that's geographically over here or separated in some other way, but people are hesitant to want to identify issues in their own community for a lot of really good reasons. I think those are the two things that come to mind for me on that.
This is Mira Yusuf from Monsoon. I think one thing that I've noticed is the missing. I would like to have more like racial, class, maybe even sex and gender, like discussion on this one, because I am really interested of then if we're talking about youth violence and especially like bullying, is there like a significant numbers for certain communities? Because they might be, for example, me coming from the Asian community might think like during COVID, is there then more an increased number of anti-Asian hate or some sort of like this discussion of race and gender, and then even immigration status, right? And how is that affecting this these numbers? And then at the same time, I know that it was translated to Spanish, but then what about the non-Spanish speakers? So, I mean, we have a growing immigrant population that is beyond the Latin population. So I think that is also something for me that will be helpful for me and my work. And then just highlighting what Kelly Marie had stated about specifically on sexual violence, there's a lot of for me, there's a big difference between disclosures and versus reporting. So there might be a disclosure of sexual violence with friends, but not reporting. So then I think they also need to be like digging deeper of what does that really mean and what does it look like when we ask those questions. So I just kind of want to just want to stop there.
Thank you so much for that. For our next question, really looking at what are some resources you recommend for caring adults, parents, and others when talking with youth about safety and violence or harm?
I can start here, though you're gonna have to time check me because this is a topic I could talk about forever, right? And so kind of one of the first ones that I might be a little bit biased because it does come out of our office, but one of the first ones that I typically recommend is Iowa Safe Youth Collaborative website. We can pop it in the chat so that y'all can see it if you haven't seen it before. It basically, the reason that we started a website like that, I think, is really because as some of the parents in the office, people who knew us as parents and also knew the kind of work that we did, were often asking us all kinds of questions about really everything from, oh no, someone on, who's listed on the sex offender registry moved into my neighborhood. What do I do? To like, oh no, my child has disclosed that they have a friend who experienced sexual violence, and like everything on the whole kind of spectrum or continuum. And it was difficult for us always even to balance those whole work responsibilities and to be able to put our hands on exactly the right resource that we wanted to in exactly the right moment, right? You're thinking, oh, I just read an article about that the other day. I just saw a really great video, and now I've got to try to scramble and find it. And so it really started as an internal kind of site to be able to put a bunch of things together in a way that was easy to find and search and discover. And so now as you look at that resource, it has a lot of different links. It has things, everything from ages infant and toddler all the way up through young adulthood. And the first thing you're going to see when you go on that website is what age is the young person you want resources for, and to be able to find that. So I think that that's a really good one as a nice starting place that can get you access to a lot of different materials all in one spot. We also have several curriculums that we support, that we have educators that do all over the state. There's an Askable Adults kind of training that you can look for in your community that really just teaches grown folks, whether they are parents or teachers or coaches or mentors, to be more askable, to be more approachable, to be a person that young people feel comfortable coming to and talking to. So that's a training that we have. We do some training that's kind of on that harm prevention side. So understanding and responding to sexual behaviors of children, or understanding and responding to sexual behaviors of adolescents, really trying to figure out where that harm is beginning, and teaching, again, grown folks to be able to respond appropriately, put appropriate resources in place, and be able to interrupt that harm before it starts to escalate further on down the line. And then we also have some disability-specific curriculum, making safe and protective environments for children with disabilities, so that we can look at what are the policies that need to be in place in the organizations that we're sending our children to. What kinds of questions should I be asking as a parent before I'm gonna a new childcare provider or a new day camp or dance studio or sport team or any of those things. So those are some of the things that I recommend.
Thank you, Kelly Marie. I'm going to open it up to our other panelists. Mira, anything to add?
I'm coming back again on the culturally specific methods or strategies. I think we don't have yet like what Kelly Marie had, Iowa CASA basically had created that specifically for parents in how to like discuss different issues with youth or children. But I think for us, like culturally specific programming is how do we create those spaces for parents to just have a discussion about like certain things that they are kind of facing with their youth, right? Especially if you have recent immigrant and with like children who were born and raised in this country. So that is then this intergenerational conflict that needs to be discussed. So we have created at Monsoon just recently with our youth violence prevention program, is one of our youth interns is from the Iraqi community. So she's Arab and Muslim. So therefore there's a lot of like conflict between those Western ways of doing things, and then plus if you are an immigrant coming from the Arab community or from the Muslim community, there's going to be some conflict. So therefore, like our young person basically just said, hey, let me create that space just for us to discuss this. So those are the ways that we can also create spaces for our young people to have this, especially immigrant and refugee youth, to have that space to discuss with each other those strategies in talking with their parents in discussing about dating. Are they allowed to date? What if they went out? I mean, those things for us, I think, are crucial. So it is important then to create those spaces for specific communities that will have specific needs and maybe specific strategies. So yeah.
Absolutely. Well said. Building off of that, um, the question I would have is, can you share how you have built or sustained programming that's led by youth facilitation and some of that priority setting?
So Monsoon is one of the recipients of SBP and RPE funding from Iowa CASA. Since we started back in 2007, 8, right? So one of our very first funding is from basically RPE. I think our strategy is like we have to, I think, especially when we're thinking about gender-based violence, sexual violence, or domestic violence, elders don't want to talk about that, especially in the Asian community. So young people do. So what we've done then is we did a community assessment back in 2008, funded by SBP or RPE, back in that day, but centering young people. Like we did a focused, not only a focus group discussion, but we did a photo voice project with young people of taking photos of what does gender looks like in the API community, in the Asian community. And then from there, we had this discussion. Their parents came and, looked at the photos. We had a discussion. But then at the same time, while we're doing that, is we have also hired young people, youth interns who were in middle school, funded again by SBP and RPE, to be the one who are planning, implementing, and evaluating everything, right? So then it becomes youth-led project. So for us, it is important that when we are talking about young people, that they are included. So now we have Kate Bailey, who is our children and youth coordinator, plus Bowie, who's also part of our team. Kate has been like a volunteer back when she was in high school, then during when she was in college, she was like one of our interns. So now she's leading the project. So that's also part of the sustainability of it's not just money, but it's also then training young people how to do this work. As we get old, we have to think about those young folks who will then do the work. So a lot of mentoring. And then we have to look at this intergenerational, like sometimes they do different, like Gen Z does different things as I'm a Gen X. That needs to have a discussion because sometimes we're clashing, right? So those things also needs to be kind of like discussed when you have a youth programming. So I just want to kind of highlight how it is important that if we are saying that you will have a prevention specifically for youth, that you let them lead it and fund it and pay them. Do not just let them volunteer, but really.
While we're waiting for Mira to jump back on, I'm going to bounce over to a question that came in from one of our members of the audience, and then we're going to give the mic back over to Mira once we've got her back, okay? So the question that's coming in is, it is always so great to gather data to work from, but how do you make actionable plans? I'm going to pause my question and throw it back over to Mira. Mira, we don't want to interrupt you. I can't remember when we lost you, but
Me too. I don't even remember what I was saying. So I don't know where I ended, but I think
Mira, you were saying pay them, so keep saying
pay
that.
them. Mm-hmm.
Oh yeah, that. I just want to make sure that you when you're hiring, when you want to young people to be included, just make sure that they are also like part of your budget. Also just have patience with them. Really have patience with young people, especially if you're like from a different generation. Just be patient. Eventually they'll get there.
Thank you so much.
And also, I just want to highlight, Monica, that also I think it is important that we really listen to them. I think as especially in my community, it is very difficult for us sometimes to say what we want to say to an elder. So I think that's also something that we are trying to figure out as a API organization, is how then do we talk to our elders in a way that it's not being disrespectful. So yeah. Thank you.
Thank you, Mira. We're gonna have some other really great questions that are coming in. The one from an audience member is, it is always so great to gather data to work from, but how do you make actionable plans to address violence in Iowa? And the follow-up is, will we reevaluate after such plans or interventions to determine the effectiveness? Who wants to start that one?
I'll start because this one excites me. Um, I'll start with the second question. Will you reevaluate? I would love to, and I will sign myself up to do the reevaluation because I'd be really excited. We've already had changes in what we want to do next, and I saw conversations about what we would want to do better for this evaluation, what we would want to add. And making sure with RPE, which again is kind of where the funnel where the funding for this survey came from, we are looking to include community voice. And again, that can be a very broad term, or it can be maybe not a broad term, but that could be taken in a lot of different ways. And we can make community mean what it needs to mean as far as violence prevention. But we want violence prevention to be applied the way communities need it to be applied, which was a part of the reason why we did the survey for perceptions and how people are experiencing violence kind of through their eyes and through their experience. But what we saw through the chat on the different racial demographics and languages that we had represented, that would be something we would want to be able to apply with the survey and doing this again. As far as actionable plans, some things that we are trying to do right now is, again, being able to have community involved in the prevention work. And involved in the prevention resources. So when we say primary prevention of things like sexual violence and things like just physical violence or intimate partner violence, that includes things like adequate housing, you have enough food in your house. And so being able for families be able to voice that and be able to participate and access those kinds of primary prevention supports now based on those supports. Since we saw youth violence be such a focus in these results, we'll want youth and parent voice a little bit more in what actions and what resources and primary prevention will be appropriate and helpful to them in reducing that in those communities.
Thank you, Abby. Any other comments from Kelly Marie or Mira before the next question?
Yeah, I think so. Full disclosure, as a non-academic, non-researcher kind of person, there's a part of me that loves this data, right? I'm here, I'm doing it, we're doing the thing. It's very helpful to us, obviously, when we're writing grants to be able to use some of this kind of data, especially as in our state, we are struggling to get access to large data sets. And so being able to have some of that data can be really helpful for us. And it's only as useful as it's applicable to the communities that we're working in. And so I always like to take things like this survey that we're talking about today, things like some of the CDC risk and protective factors that we use a lot in our work, and just bring them to the communities that we're doing the work with and say, here's what the research says. What do you think about that, right? Is that resonating with you? Do you think there's more of this actually, or less of this, right? Like when I'm working with young people, all right, so we did the survey that says that a lot of parents are talking to you about this. Are your parents talking to you about this, right? Like, what does that mean? And just be able to use the data not as a driver of program decision making, but as a jumping off point, right? When, sometimes, especially if you're talking about topics that are hard for communities to have conversations about, being able to use some piece of research and have them react to that and respond to that, as opposed to just trying to start a conversation from the ground, can be an easier entry point for people. And to be honest, sometimes we all like to pick apart research and researchers, and so it can get a lot of energy in a conversation that might not have a lot of energy on its own. But if I have that thing we can respond to, then we can really start to talk about, okay, how do we use this to tell our own stories and to do the programming that really needs to happen in our.
Thank you. All right. Next question. Will you talk through some of the values that drive your prevention work and share some of the things you're most excited about?
I guess I can respond to that. And I will apologize in advance just in case that I freeze, because our internet here in the office is really very not good. So I just want to apologize. But I think so Monsoon is a feminist organization. So the core values that is informing our work is our feminism, our activism, and then also, like, since we are immigrants and coming from countries that were former colonized, so there's also this decolonization part of it. So therefore, when we have that type of core values, then we are going to lift our own traditional practices that are healing and that are like that is more like liberatory instead of the oppressive one. All right. So what we then do is we center community as a solution. But then at the same time, we need to understand that public health model is also as important. So we need to combine those in order for us to then create, really innovative way of doing things. And then this inclusion is also as important for us to make sure that folks who are like on the margin, or folks who are like in our community, like for example, if it's the LGBTQ community, we need to also then like lift them up in order for us to have this, like a really, so we're not forgetting anyone. So I'm just coming back from Hawaii. So this all, like Ohana kind of thing is about the family, how important that is. I think for me, like when we're thinking about prevention work, is really like it's a community lift, right? It's not an organization lift, but it's really our community lifting it together in order for us to have a very safe, less harmful society, right? And it's not just the kids from our community, but all the kids that like everywhere, right? Because for us, it's important that it's not just API youth that we are like lifting, but it's also youth from, like, let's say, the African community, the African American community, the Latino community, the deaf and hard of hearing. So those for us is really important. And what I'm really excited about is just really like what this future will look like, because I'm really like, even though like sometimes I will have conflict with like the Gen Z, right? Gen Z, but sometimes they're like smarter than me. They're full of wisdom. So I think that's more I'm excited. And I'm really excited for the next generation, because I think this next generation is really like smarter, have more wisdom, more open. So that is what I'm excited about. Did I answer your question, Monica? Hopefully I did.
You did. You did so well, Mir. Always, everything that you say is on point. It's exciting to hear you speak. There's so much joy in it. Kelly Marie Appy, is there anything you would like to share?
I think for me, yes, all of that. And we've spent a long time in this movement trying to teach people how to not do bad stuff, right? And that's like, those are not fun conversations to have. They're not joyful conversations to have, and they're not getting us anywhere, right? And so really being able to have the space to talk about the world that we want to build and what it is that we need to do to get there is what drives, I think, a lot of us to do this work, right? Certainly what gets me up in the morning to do it. We don't always get that space. And I like to go back to this survey. The one thing that I was really excited to see was focus on that percentage of people that believe that all these kinds of harm can be prevented. Like, that's fantastic. That's data I didn't have before. Sometimes I can get down on like, oh, I believe this, but no one else thinks that. And it's this uphill battle. And to see that there are so many Iowans that really do believe that all of this work that we're doing is preventable, like, that is huge to me. And so to be able to use that as a springboard to talk with all kinds of folks in all kinds of communities to say, all right, so we think it can be prevented. This is what I think about how we get there. What do you think about how we get there, right? Like, what can we build and fund and just dream about together is really exciting.
Thank you. All right, I've got one more question before going back into audience questions and opening it up more for anyone who wants to raise their hand and speak directly with the group.
I will say, Monica, we do have someone with their hand raised. Can
We
we
do? Oh,
go
yeah,
to
please.
Eric?
Yes, oh, absolutely. We'll pass it over.
All right, Eric, do you have the ability to unmute?
How's that?
Awesome.
So I would want to thank everybody who was a part of the survey and bringing this data forward. I know it could be a huge undertaking, first and foremost. Yeah, just like some people were commenting, I would have liked to see more of a comprehensive data information regarding immigrants, refugees, different languages, cultural contexts, with how those survey questions would have been answered in. Did they understand the questions? Was there a correlation or dissonance between those cultural norms and understandings and how these questions were pointed? The other thing is just looking at the gender statistics on here. Just kind of wanted to gain a more understanding of, within that cultural context of those men that for some things that they weren't talking about, like not being violent or were they being harmed, what lens was that being looked into from a cultural perspective? Were some of these men working, not working? Same thing with mothers. Were they working, not working? What was that data on? My main focus of the question was, in part, the last question that I added in the chat was, how are we using this data to kind of actively, shape or create or influence policy and procedures within structures that limit kind of that prevention work within schools, within communities, within different organizations. So just kind of wanted to touch on that a little bit.
Thank you, Eric, for bringing that forward. I'm going to open up Eric's question to our panelists.
I'm going to open this up, Carrie. I don't know if you have any more details that you want to give on the survey data or demographic stuff.
So as I put in the chat, we did try to get more surveys from minoritized populations, but unfortunately we're unsuccessful. I do think the work that the panel has been describing around community voice will be super important to this work, because I always think of surveys as like a quick glimpse at an overall, right? And doing these interviews and focus groups and work with the communities will give us so much more information. Even as a person who loves numbers, then those sort of conversations will be so much more important. We haven't looked necessarily from like looking at whether the parent was working or not. That is data we have, whether they've experienced violence or not. We do have that data. I don't recall it right off the top of my head, but I can definitely follow back up with you, Eric, about that. Those are all really good questions.
Thank you.
I also just want to kind of chime in some way. Like I just feel like that this survey is just the beginning, right? It's just this like it's just like an like it's just like a start. So then as we build to make Iowa better for everyone, I think there's then a space to do more like community listening sessions, participatory action research, right? So Monica, I think what we're asking for is more funding for those type of work, right? So if we are thinking about our different communities, is providing them those resources in order to do this work. And then also arming our community members, whether they're non-English speakers, to understand like what is like a way to critically look at your community and what does that community need in order to be safe, in order to be healthy, in order to focus healing and wellness. So those are the things that we need to like sometimes for me, this is just the beginning. And then we'll figure it out. Okay, we have these numbers, right? So let's dig on, like, let's look at the incoming refugee community. What do they need? So I think, so I just want to add that it, for me, is just like a little, it's just a beginning.
Any other comments in response to Eric's question? All right. I'm going to open it up to other audience members. If anyone is interested in asking your question directly at this time, you can raise your hand and we will call on you, or you can unmute and jump in.
Monica, there is one additional question in the Q&A.
Oh, thank you. All right. Oh, wonderful. Okay, so the question that came in is specific to brain health. There's data in sexual violence and correlation in adults with traumatic brain injury. Has there been research addressing children, youth with traumatic brain injury and child sexual abuse harm? Does anyone from the panel want to comment to that? So while I am not a panel person, I will absolutely share out that at Iowa HHS, we have some amazing folks that we collaborate closely with in the traumatic brain injury space. And really, when we're looking at understanding adverse childhood experiences, child sexual abuse is one of those. And when we look at child abuse and neglect, there are certain criteria in the Iowa Code that constitutes a traumatic brain injury. And so I would definitely recommend connecting more with the Brain Injury Alliance of Iowa, as well as our brain injury program here at Iowa HHS. But also know that we collaborate very closely with them because they're the injury side of injury and violence prevention. And if that's a specialized area that your group is interested in expanding more Iowa-specific data around, we would always be interested in collaborating in growing that, especially in that qualitative information that Mira spoke to around community listening sessions and building that out from there.
I am going to real quick throw the mic. I saw Jim Pender. You raise your hand, and Jim is from
Yay,
is
Jim's
one of our champions in brain injury. So Jim, I'll give you the mic to be able to unmute.
Hi, good afternoon. It's great to see everyone. Yes, my name is Jim Pender. I'm with the Iowa Department of Health and Human Services. I work in the Brain Injury Services program. To speak to that question, I'll just say briefly, as Monica was suggesting, in Iowa Administrative Code, Chapter 83, if you want to be a nerd about administrative code, there's 46 different diagnoses that constitute a brain injury. Child maltreatment syndrome is one of those, but within that, there are also other things that one may experience. Toxic effects of substances, any number of things that may qualify in that realm. If you have interest to know more about that, you can reach me. I'll drop my email in the chat. With respect to that research, I'm sure Iowa hasn't done any specific research in that area or have any specific data in that area, but could probably find it, with some of the networks that we have.
Thanks, Jim. I'm happy you're on
Yeah.
today. All right, I'm going to open it up for one final question if anyone wants to ask the group directly before I do some of our closing statements. All right, we'll continue to drop questions in the chat. Also, feel free to reach out by email with any questions. In closing today, as you can see, thank you so much to our panelists. Hearing from partners that we have across the state working to improve the safety, health, and well-being of communities across Iowa, it brings me so much joy, excitement, and energy. But what all of you can see who are participating today is it does take all of us, right? And we're building this space together. And there's opportunities that will come up to help amplify everything that folks are sharing about, hey, we need more youth-led programming. We need to create those things. We need to make that happen, and that takes all of us. One of our shared, visions and beliefs is really that space that it's our collective responsibility to prevent sexual violence, but also to build the spaces that are safe and that we can all thrive within. And so again, this takes all of us coming together and coming up with solutions. And solutions will look different depending on the community because of a variety of different aspects, lived experiences, and those elements that are culturally relevant as well as age. And so with that, thank you so much for your time today. And please reach out and let us know how we can support your local work, any local work groups, coalitions, parent groups. We are continuously looking for partners across the state. Thank you so much, everyone. Enjoy the rest of your day.